Hey Sam, I was going through this detailed guide on resuscitation, and it really struck me how complex and critical the protocols are, especially in cases of near drowning. Did you know that the first aider is essentially acting as a machine, keeping the victim's vital tissues oxygenated until expert help arrives?
Yeah, I've read about that. It's kind of daunting when you think about it. I mean, the chances of actually restarting someone's heart with CPR alone are pretty slim, especially if it's a heart attack. But for near-drowning victims, it seems like there's a better chance because they're often younger and healthier.
Exactly. And the guide emphasized that with near drowning, the first aider might actually succeed without a defibrillator, which isn't the case with heart attack victims. The focus is really on maintaining that oxygen flow until more advanced care can take over. Also, I've been going over the resuscitation protocols, and I noticed there's a distinction between how you handle drowning victims versus those with suspected heart attacks.
Yeah, it's pretty interesting how the procedures differ. For drowning victims who are unresponsive and not breathing, you start with 5 rescue breaths right away, right?
Exactly. And if the victim is still not breathing after those breaths, you move on to CPR for 1 minute. After that, you should phone, radio, or go for help, then return and reassess the situation.
So the sequence is really specific. It makes sense to work methodically so nothing important gets missed. But what about if you're dealing with someone who's had a heart attack?
For a suspected heart attack, the first step is to phone, radio, or go for help immediately before you do anything else. Then you come back and reassess.
That makes sense. And when there are multiple rescuers, the process gets a bit more straightforward. One person can go for help while the other starts resuscitation. For drowning victims, it's the same process with those initial 5 rescue breaths, right?
Right. And if they're still unresponsive and not breathing, you give another set of 5 rescue breaths, followed by 30 chest compressions and 2 breaths. You continue that until either the victim starts breathing or help arrives.
And for a heart attack situation, it's all about the compressions, 30 compressions followed by 2 breaths, and just keep that going until there's a sign of life or help arrives.
Exactly. The emphasis on compressions for heart attacks really highlights how critical it is to keep the blood circulating, especially since they usually have oxygen in their blood for a few minutes after the heart stops.
It's fascinating how specific these protocols are, but it's also reassuring to have clear guidelines to follow in such high-stress situations. But what really caught my attention was the emphasis on mouth-to-mouth resuscitation and how to handle situations where the chest doesn't rise.
I know. They pointed out that if the chest isn't rising, you need to check a few things, like the head tilt, pinching the nose, and ensuring a proper seal around the mouth. If none of those are the issue, then you might be dealing with an obstruction that you need to clear.
And they even address the use of masks and face shields. The guide acknowledges that while the risk of infection is low, it's still there, and using a mask can make the process more effective and less unpleasant for the rescuer.
True, and in cases where the face is damaged, the guide mentions switching to mouth-to-nose resuscitation, which I hadn't really thought about before. It's good to know there's a backup method if needed.
Right, and if all else fails, they suggest just sticking to chest compressions alone if rescue breaths aren't possible. I think that's reassuring because it takes some of the pressure off, knowing that even if you can't do everything perfectly, you can still help.
Absolutely. The section on CPR itself was really detailed too. They explained how to do the chest compressions properly, like keeping your arms straight, using the heel of your hand, and making sure the victim is on a firm surface.
Yeah, they even give specific measurements, compressing the chest about 1.5 to 2 inches deep at a rate of around 100 compressions per minute. It's such a precise process, but it's what keeps the blood circulating to the vital organs.
And then there's the whole concept of dry drowning, where the victim's body essentially suffocates because the throat muscles spasm and block the airway. I found it fascinating how the act of rescue breathing can actually open up the airway in these cases.
That's pretty amazing. It's like the body's last-ditch effort to survive. But I was also intrigued by the mammalian diving reflex they mentioned. It's incredible how the body can slow the heartbeat to almost nothing, conserving oxygen for the brain when submerged in cold water.
And that's why the golden hour is so crucial, especially in cold water drownings. People have actually survived after being submerged for up to an hour, or even longer in some rare cases. It's almost like the body goes into a sort of suspended animation.
Exactly. But then there's also the risk of secondary drowning, which can happen hours after a near-drowning incident. The guide emphasized how important it is to get the victim to a hospital, even if they seem fine.
Yes, and they highlighted how the body absorbs water into the bloodstream, leading to chemical imbalances and other complications. It's scary to think someone could be fine one moment and then deteriorate rapidly later on.
And then there are the challenges specific to whitewater environments. The elements, cold water, and the remoteness of some locations all make resuscitation even more difficult. The guide mentions how even checking for vital signs like breathing and pulse can be a challenge in these conditions.
It's a lot to consider. The guide also discussed when to stop CPR, which is something that's not often talked about in standard first aid courses. In remote situations, they say it's reasonable to stop if there's no sign of life after 30 minutes.
That part really stood out to me too. It's a harsh reality, but the guide makes it clear that in some cases, it's just not possible to save someone without expert medical help. But even then, the advice is to do what you can, because you might get lucky or at least feel better knowing you tried everything.
I agree. And the emphasis on practice was spot on. They really drive home the point that these are skills that need to be kept up to date. It's not just about knowing what to do, it's about being able to do it under pressure.
Definitely. I think after reading this, I'm more motivated than ever to stay sharp on these skills. You never know when you might need them, and being prepared could make all the difference.